right. All right, so we're at the clinic today here at PT Works, and we are going to talk about ways to improve knee flexion. There are a couple of joints here that we have to think about. You have your patellofemoral joint, you have your tibiofibular joint, and we have your tibiofemoral joint. So in that respect, your therapist would have to distinguish which joint to address. If it was your patellofemoral joint, to improve knee flexion would be I have to take the table up a little bit, would be a inferior glide, right? So it would look like this. If I'm suspecting soft tissue impairments or dysfunctions in the distal quad, then we have to do soft tissue mobilization, ISDM, whatever soft tissue techniques we know to improve the quad flexibility, we have to do that. We can also improve soft tissue flexibility of the patellar tendon, okay? So joint-wise, as I said, patellar inferior glide, and then we could also do a posterior glide of the tibia on the femur, okay? So we can do a posterior glide, we could be as gentle as possible, and we could do this based on the patient's irritability. So if the patient is irritable or in high levels of pain, we could do it in resting position. And if they're not, and we talked about this, we could do it in varying degrees of knee flexion. So we could do it here and still a posterior glide of the tibia on the femur. So that would attempt to improve the mechanics of the knee. So you could do it in varying degrees of knee flexion. Okay? Now if it is an athlete or a high-level individual and the knee flexion is almost full, let's go ahead and roll on your stomach. If it's almost full, then you could passively bend it. If this was the same side that we're working on, you could passively bend it so you could stretch the quads, but at the same time, you're forcing that joint to bend. Now, a little thing that we do here differently is that if you have a lateral knee joint pain, you can actually push towards flexion and twist it laterally as well. So if it was a clock, we would need to do like an 11 o'clock here. So flexion towards 11 o'clock. If it's a lateral knee joint pain, meniscal pain, lateral knee pain, that limits that bending. And if it was a medial knee pain, then you could go to that 1 o'clock kind of flexion. Okay, so you have a varus and valgus force added on that knee flexion instead of that straight joint plane movement. Okay, that's the little twist that we do to improve and to tweak out impairments of knee flexion. All right, thank you.